Hi, my name is Jill Beytebiere, and I want to share with you 5 observations that I made after the coronavirus hit home this last week. I'm a healthcare worker, and I had one client who had some connection with the Kirkland nursing home facility, so that was a little bit of a scare. And then another client that I sat with for 12-hour stretches who was sneezing, and all the droplets were landing on my bag of food and my phone and my laptop, and just everything that was exposed. Anyway, so I just came up with some observations of what does and what doesn't work, and some things that we trust in that we shouldn't. And then I have a little bonus observation and something that is even more important, I feel. But first of all, I'd like to say that we're not as safe as we think. 80% of the people who are affected by the coronavirus have a mild case, but to prevent the spread of the disease is much trickier than it might seem. So, tip number 1, don't have a false sense of security if you're wearing gloves. Just because you have gloves on doesn't mean that you can touch anything. A lot of people feel like if they've got gloves on, they're scot-free. But if you touch something that's germy and then you touch your eyes, you can infect yourself. If you touch your nose and you're infected, you can infect them. So gloves are great, but you do need to be careful. And when you take the gloves out of the box, you want to make sure that you've washed your hands first. If your hands are dirty and you reach in to take the gloves, you've just contaminated the whole box. Another thing is, when you're washing your hands, a lot of people just turn off the faucet, but if you touched the faucet before you washed your hands and your hands were germy, then you just got the germs on the faucet. When you turned it off, you get those same germs back on your hands. So there's 3 ways you can handle that. 1, you could use paper towel. Hopefully nobody sneezed on the paper towel. And the other option is to use your wrist, because generally you're not going to use your wrist to touch things, and so that will keep it a little bit cleaner. And another option is to use hand sanitizer after you're done washing your hands, but I can tell you from experience that that will dry out your hands and they will get all cracked. It's not really an ideal situation. And now for tip number 4. You can't go around wiping up the surfaces all day long, keeping up after everybody. It's just a losing battle. So if somebody happens to come through who's sick or who has just blown their nose and they reach into the fridge and touch the milk and touch the butter wrapper and the lettuce bag, you can't wipe all those things down. So the really important thing is to make sure that anybody with symptoms actually stays in their bedroom. And that is harder than you think. They tend to wander out. So I have some strategies on how to keep people in their bedroom and have that go a lot better, which I'm going to share in my next video. So tip number 5 is do your best and don't stress. It's not possible to eliminate all the germs from your environment. You can try as hard as you want not to touch your face, but you know you're going to touch your face. Your hand does that automatically. You can wear a mask, but your mask will fall down, as mine has several times when I've been taking care of my clients. It just starts to slip, and then what do you do if you touch your mask? You get the germs on your gloves, and they also ask you to wear the same mask over and over again because there's a shortage of them, so that's another problem. So we can just do our best and hope for the rest. So hopefully you're sending up some prayers, because these issues are just way beyond our control, both health-wise and financially. And being stressed out won't help you. It can possibly reduce your immune system. So breathe deep. Some practices that can help are mindfulness, prayer, relaxation technique, and exercise also is a big one that's very helpful. So leave a comment in the section below telling me how this coronavirus epidemic is affecting you, and feel free to leave an emoji if you like. And the bonus tip, and I think the most important thought of all, is that this coronavirus scare is a good wake-up call for us. If you saw the raids on the grocery stores with the toilet paper flying out the doors and the rice being gone from the shelves and all the other items that there were shortages on, this sort of thing can and will happen again. Next time we need to be ready. So this is a good opportunity for us to rethink everything that we normally do. Guaranteed, things are going to happen, things are going to come up that will wreak havoc with our finances finances and our health. And we need to be on our A game and think about the ways that we are earning money, the ways that we're spending money, and the way we eat, the way we socialize. All these things we'll have to rethink. And we haven't seen an end to it. The rate at which the powers which be were able to act quickly and basically close down our society as we know it is something that could easily and will happen again, and we do need to hope for the best and prepare for the worst. So I'm going to be doing a series to share some thoughts that I've had on how we can best adapt to the changes that are rapidly occurring after this virus. So please be sure to subscribe and ring the notification bell, and I'll be covering things like how to make the most of our money, how to improve our health, how to deal with weight issues and depression, and how to keep our relationships with our loved ones together during this stressful time. And I have a fun thing that you can do if you like. If you want to take a short 10 or 20-second video clip sharing what your thoughts are on the coronavirus or some way that it's affecting you, I will try to use some of those in an upcoming video. So you can send those to jillbeytebiere at lifebuildingmedia.com. So stay tuned for my next video, which deals with how to stay safe when you have a sick person in your household. So thank you for watching, and we'll see you in the next